it's time for your horror medication. Before I begin my story, make sure you're not going to be interrupted. Check that you're secure. Make sure no one or anything can get you. Then get comfortable. Just close your eyes and let your imagination do the work. I've just moved along your ear canal and I'm now inside your skull. Horror medication. Written and narrated by Bleeding Critic. It's so easy to impersonate a member of staff at this hospital. You see, there's no security. So many people, so easy to blend in with the medical crowd. I smell vulnerability and worry in the air from those waiting for their dear ones to return from surgery. I saw a frail old woman sitting on a wheelchair being pushed along a white corridor who looked exactly like your dead mother. For a few seconds I thought she escaped from her rotten coffin to stop me from what I'm going to do to you. I can hear the sound of wind outside this hospital and I know it's not wind. It's only the screams of spirits that were recently evicted from their dead cold bodies. They're screaming and angry at me. It's easy to get lost in large hospitals and easy to be forgotten about. I walked past an abandoned hospital bed with a small body lying underneath a white cotton sheet. Was it a patient that was forgotten about? Was I actually looking at your dead body? You know something, because the body I'm in is healthy and incredibly fit, I feel powerful, walking around the hospital wards, looking into the tired eyes of the vulnerable patients. Some of the religious know about me and will tell you what I do is terrible, but I know you'll understand. Be reassured, I only target the rusted elderly. Those old people that go to so many hospital appointments just to find a way to stay alive. You've seen them return to their doctor again and again, always something else inside shutting down, just like old cars. The older it gets, the more you have to spend to keep it on the road. I'll share some of my murder methods. Making them overdose from the depressants, morphine and alcohol, a toxic mix which attacks your central nervous system. First off, you want to vomit but you can't, which leads to coma, and after a respiratory shutdown, death. No time for family and friends to say their goodbyes. Look, I know life is valuable, and my let's call them clients. They've had a full life already. Why can't they grow old with dignity? And when the insides beneath their thin, crinkly skin starts to deteriorate, let it roll on to the inevitable. Next time you hear about a hospital patient death caused by a mysterious overdose, you'll know it's my bleeding work. I targeted someone who had open surgery due to Crohn's disease. Just before the operation, I intravenously administered diluted anaesthetic direct into the patient. I got a rush looking into their eyes, knowing they could feel every cut and fumbling the surgeon was doing. I had that connection with this patient. It was almost erotic. I watched the surgeon cut and remove the diseased portion of the intestine and then reattach the healthy ends of the intestine. I guess you're disgusted with me. But think about it this way. Many people spend thousands to change the way they look. They want to look younger. Why can't they be proud to be themselves? Some very old people just want their heart to beat as long as possible, no matter the cost or inconvenience. Why can't they be proud to live the life they've already had and die when it's their time? Is it greed? Is it selfish? My job is to rid those that cheat their dead by date. I'll do my bit, making sure the population is balanced. When this body I'm occupying can't function anymore, I'll climb into the mouth of a hospital priest and possess them. And I'll make sure to visit the frail and old when they're alone on the ward, wanting to connect with Jesus. And I'll do the right thing and I'll hold their hand, I'll comfort them, and then I'll place their whole delicate head in my mouth. And if they're recovering from surgery, I'll get the priest I've possessed to sexually invade their fresh wound, causing serious body injury. When you're very old, ending up in hospital hoping to prolong your life, you won't be able to spot me. I might be a student nurse. I may even be your surgeon. You won't know or be sure if it's me. But if someone is interfering with your IV drip that goes straight into your vein, or during an open heart surgery operation you wake up terrified in unbearable pain and you notice a stranger smiling at you, that'll be me. You can try and cheat your dead by dates, but I'll be the one making sure you're disposed of when your time is up. I look forward in feeding you my horror medication. In the meantime, make sure you talk about me. Refer to me as the chameleon demon. I was born demon and I love my job. Horror medication. Written and narrated by Bleeding Critic.